Okay, so like I mentioned before, sometimes we might experience, all of us must have experienced, there's one time that we can't sleep, or like there's one time that we don't have appetite, okay, there's one time that we don't feel, there's one time that we don't feel like doing anything. All of us experience that, okay? So because sometimes we do feel sad. Okay, when we feel sad, we might have the signs and symptoms that I mentioned before, but there's difference for someone yang depressed and someone who is just sad. Okay, so knowing the differences is very important, because if you know the difference, if you know that this is something that is more serious than just sadness, you would want to seek for help. Okay, so usually what are the difference between the normal sadness and depression? Okay, in sadness ataupun kehibaan, okay, of course you're going to feel that pain in you lah, there's pain, repeating pain inside you. But for example okay, the cause of your sadness is losing your loved one. Okay, someone that you love died. Okay, alright. So of course you feel sad. Okay, that pain will always comes to you, but be able to think of those sweet memories, of the good memories that you have with your loved ones who died. Okay, but in someone who depressed, they cannot think of anything positive. Alright, it was just always sad, negative. Alright, no room of positiveness. Alright, so and again see, secara berterusan untuk selama hampir 2 minggu. So it must be ongoing until 2 weeks, and during these 2 weeks tak ada not a spark of happiness pun inside their feelings. So that might this someone is probably depressed. Okay, and then usually if we are sad, we still have our confidence. Okay, for example, we might feel sad for a few days, but then we're able to do our job and everything. So we don't really hate ourselves. We feel sad, but we don't hate ourselves, which is not the case for someone who depressed. Okay, so it's very important to know the difference. Okay, so that we can get help if we feel that this is something more than just normal sadness. Okay, the next slide. Alright. So the myth of depression, kemurungan biasanya dapat diselesaikan secara spontan dalam 2 ke 3 bulan. Okay. Depression is not something that can be solved just within 2 or 3 months. Okay. It's something that is, for example, the cause of your depression is also complicated, complex. Betul tak? It's, benda-benda simple cannot buat us depressed. Okay, it must be big things. It must be a very big issues. Okay, something that has been ongoing for years maybe that cause us to be depressed. So we can't expect for this depression to go away, alright, 4 to 3 months. Okay, so actually, okay, the fact is depression, ongoing depression may take time, up to 2 years. Alright, 2 years of ongoing treatment to until we can get remission. Alright, until someone feels feels stable. Okay. Another myth is kecuali mental tidak memberi kesan kepada kesihatan fizikal. This one I mentioned before lah. Alright, okay. That's why it's very important to take care of our mental health. Alright, the next slide. Okay, now we go to anxiety. Okay, anxiety is one of the most common mental illness, alright, in the whole wide world. Okay, so according to epidemiological studies, 1/3 of population, alright, may at least once have anxiety disorder in their lifetime. So very common, okay, and the anxiety disorder usually high in prevalence in the youngsters, alright, usually in mid-30s. Okay, but panic disorders are more in those who are middle age. When you're around 40 to 50, okay, that is senang nak dapat panic disorder. Okay, and again, anxiety just like depression is more in women rather than men. Okay, dekat sini ada the small picture there, ada cakap 59.2% from those with depression or MDD, major depression, can get anxiety disorder. So actually, depression and anxiety is very much related. Okay, it's very common, or it's not something surprising pun if we found out that those with depressed also have anxiety disorders. Okay, right? Next slide. We have anxiety disorder is one of disorder yang ada banyak sub illness under them. Okay, we have a lot of anxiety disorder. Okay, we have, for example, GAD or generalized anxiety disorder. First picture tu. Alright, generalized anxiety disorder is when someone ada anxiety symptoms. Okay, nanti we go through lah what is anxiety symptoms. Okay, alright. GAD is someone with anxiety symptoms that is causing distress in their daily life without any specific reason. Okay, semua benda boleh buat dia risau. For example, if this person is a mother, if the patient is a mother, okay, alright. If she's having a GAD, she will have anxiety symptoms just thinking about her kids in the school, her husband at work. Okay, like apa dia orang buat, what are they doing, are they okay, are they doing fine. So it's just a normal day for everyone, but even the daily life punya routine pun will cause this patient to have anxiety disorder. So it never resolve lah. Okay, there's always something that makes this person very anxious. When I say, and it's not normally anxious, it's anxious that cause distress or affect their functioning. Okay, then the second one is gangguan panic or panic disorders. Okay, this is when panic happens when anxiety symptoms is already to the level of the max lah. Okay, alright, and this person is going to have palpitation, jantung berdebar-debar, berpeluh, sweating, okay, chest discomfort, alright, feel like choking, okay, at one point akan rasa macam nak pingsan, feeling like nak faint, alright, or they feel dia akan rasa sudden loss of control, like they cannot do anything, suddenly panic, alright. Kalau ikut kat sini, secara macam tu, ultra menggila. So, meaning that this patient don't know what to do. Right? This is panic disorder, and it usually have triggers. Okay, so we as doctors, we have to find out what are the triggers of this panic in order for us to manage the panic. Okay, the next one is keterlaluan obsessive compulsive or OCD, obsessive compulsive disorder. Alright, this is not something bukan usually OCD is, we always misuse that term. You know, whenever we see someone who is very neat or tidy, we call that kau ni OCD lah, alright? But that's not the case. OCD is not as simple as that. OCD is not just being neat and tidy, alright? Okay, OCD is obsessive, meaning terlalu memikirkan or always think of that one particular thing. Compulsive is it keeps on repeating. The thoughts keeps on repeating. For example, alright, someone yang likes to switch on and switch off the lights. Okay, they have that sort of thought. Okay, ataupun was-was lah. Kalau Melayu kata penyakit was-was. Okay, alright, that did I switch off the light? So they will like switch on, switch off, just to make sure that it's really switched off. Okay, or when another example, those who like to this patient might have the symptoms of keep on unlock and lock dia punya car keys. Okay, we have patients like that lah. Alright, because they are not sure, did I lock the door? Did I really lock the door? So they do it repetitively just to make sure that it is really locked. Okay, so obsessive compulsive can be in a lot of patterns. Okay, and also those who are very anxious regarding kuman or any sort of infectious. Okay, that we have repetitively hand washing. Okay, which is now in COVID, of course, we kena tekankan on that hand washing, but this is extreme. Okay, up to a point, kulit dia pun rosak because of repetitively hand washing. Okay, and of course, all of this must cause distress to the patient lah, or affect the functioning for us to call it as a disorder. Alright, next slide. Then kita ada gangguan stres pasca trauma or post-traumatic disorder. Alright. Okay, those usually this is what happen when someone has a traumatic event. those who went through wars, okay, those who went through experience, near-death experience, for example, accident, okay, or a big natural disaster, okay, it's very traumatic. That afterwards, although they survive, okay, the nights after, all right, they can't sleep, okay, they have panics, they wake up middle of the night, all right, because they not only recall, okay, but they actually really were in that, as if they were in that situation. Okay, so for example, kalau dia ada kemalangan tu, okay, malam-malam dia tidur sampai dia bayangkan balik macam dia betul-betul menghadap balik kemalangan yang dialami dulu. So this will cause anxiety symptoms to this patient lah. Alright. Then we have social anxiety. Alright. This patient will feel anxious. Okay. Regarding uh, being in the apa being in a crowd, for example. So they can't really mix with others, okay, because they will have anxiety of what others will think about them. Okay, what if I did something very embarrassing? Okay, so they're going to have difficulties to go to work or go to school, or even to buy groceries. Okay, that will definitely affect their daily functioning. Alright, then we have specific phobia. So, for example, a patient who are very afraid of snake, okay, or height, or getting into aeroplane. Okay, they have anxiety symptoms that cause dysfunction or distress to them. Okay, next slide. Okay, what are the sign symptoms of those with anxiety? How are we going to detect if someone has anxiety disorder? Okay, the anxiety and the anxious must be over, okay, all right, extreme anxiety, meaning that they can't get that thought out of their mind. Okay, always think about that. For example, like I said, someone yang dah went through a very big accident, they keep on thinking of the accident every day. Okay, that they might also grow tired of just thinking. Okay, when you always thinking, overthinking about a particular thing, definitely you're going to have difficulties in sleeping. Alright, so this person also is going to have sleep disturbance. And then they have a very mempunyai ketakutan yang tidak rasional. Alright, for example, being in traffic jam, alright, can cause them to have panic. So it's a fear that is not rational, because everyone else, of course, is very stressful being in traffic jam. But for this person, okay, it's not just stressful, but it creates fear, a very big fear to this patient. Alright. And then we have this patient's going to have physical effect lah. That is ketegangan otot. Alright, the muscle will be very tense. Okay, you keep on thinking kan, so your muscle all going to be tense. Okay, you might have it gastritis. Okay, alright. Then mengalami gugup pentas. Okay, this is stage fright lah. Alright, which is actually stage fright is normal, but we can cope with it. Alright, sometimes we can cope with it. But if we really we can never do any presentation at all, even in a small crowd, that could be an issue, okay? And then having panic attacks, okay? Again, flashbacks of the trauma, okay? Flashbacks, right? The word flashback is not just recall, okay? For example, we always misuse that term. Aku terflashback lah balik masa aku kahwin dulu. Okay, that is not flashback, that is recall. Flashback means that you imagine yourself in that situation. For example, like I explained today, someone who went through a very big accident, they can really feel like as if the accident is happening again to them. So that is flashback. Okay, all right. And then we have extreme perfectionism. Okay, that is everything must be according to how they organize lah, according to dia punya ways. All right. Okay, next slide. Next, we're going to go to the third most common mental illness, which is bipolar disorder. All right. Okay. So this picture says 80% usually 80% of those with bipolar usually get it from genetic. So this is one of the mental illness who have a big percentage getting it from family lah or genetic. bipolar disorder and also schizophrenia. Alright, so Institute Kesihatan Mental Negara, okay, they have a statistic saying that about 1.1, alright, people aged from 18 years old, alright, or aged 18 years old, at one time, I'm sorry, kira-kira 1.1% daripada penduduk berumur 18 tahun atau pada satu masa sebanyak 51 juta orang yang menderita kecanduan bipolar. So about 51 million of people in the world having bipolar disorder. Alright, and what is more serious lagi, alright, kecanduan bipolar, alright, merupakan antara 10 kecelaruan paling tertinggi pada usia dewasa. Alright, this is one of the most common mental illness, alright, during adulthood. Okay, and it affects about 60 people around the world. Okay, that's according to WHO. Okay, next slide. Okay, what is bipolar disorder? Bipolar disorder uh, is an illness that will affect our mood, our thoughts, our behavior, and our functioning. And this person, right, is going to have an extreme changes, okay, from depression ataupun perasaan sedih, keletihan dan putus asa, alright, with bahagia dan bertenaga, or what we call manic or hypomanic. So bipolar disorder is actually under mood disorder. Okay, this person is going to have two moods, two extreme moods, and it can interchange within a few duration. For example, 1 week, alright, might be 2 weeks of depression. Okay, then another week of hypomanic or manic. Alright, totally opposite. That someone will say, macam as if this person ada dua personality. Alright, totally different person when they are in their different mood. Okay, alright, next slide. So what is how we going to say that this person is in manic or hypomanic, or this person is in depression? So I think we already explained what depression is. Okay, what is the symptoms of depression? In manic and hypomanic, right? This patient is going to feel very energetic, right, and very very happy. We call it very elated. Alright, nothing to be happy about. Okay, nothing that is happy, but this person is very happy. Okay, and when I say energetic, they can just do anything. Alright, okay. And then this person is at this point of time, when this person is in manic state or hypomanic state, this person is going to have increase of activities. Okay, on that day they have a lot of things they have already planned. I'm going to go here. I'm going to do this. I'm going to do all in one day. All right, very ambitious to do everything at one time. All right, this person is going to feel jumpy or wired. Okay, this person is going to have a lack of sleep. Alright, usually lack of sleep because this person, alright, they have a lot of things they plan, right? They have a lot of activities they want to do, so they feel like sleep is not important. Alright, I can live without sleep because I need to do a lot of things. Okay. Also, this person is going to talk more than usual, than they usually. So, you're going to see this person very talkative, and when they talk, at one sekejap cakap pasal benda ni, then cakap pasal benda lain, alright? They can change topics very easily, or what we call flight of ideas, okay? From one thing can cause another thing and cause another thing, alright? And this person is also going to be easily irritable, alright? Okay, even little things can cause them to be irritable, or at one point can be also aggressive, alright? And their mind are also very fast, okay? Rasa boleh melakukan banyak perkara sekaligus. Like I said like before this lah, they can do a lot of activities at one time, and at this point of time, they feel very how to say, unafraid. They are not afraid to do anything. Okay, and also they don't think of the consequences of their actions. So they're gonna spend a lot of money, alright, okay, for things that they don't need. And when I see spend a lot of money, alright, really like thousands of ringgit just in one day for things that they don't need. Okay, so that is manic, when when a bipolar patient in manic or hypomanic state. Alright, but when they are manic, probably it will last usually around 1 week, macam tu, ongoing for 1 week. Then suddenly, from a high level of extreme emotion of hypomanic and manic, they go down, tiba-tiba down, very fast to change. So tiba-tiba depressed. Okay, so from yang tadi yang very familiar, very energetic, cannot sleep, want to do a lot of things. Okay, suddenly to someone yang don't want to do anything, or feeling worthless. Okay, probably ada suicidal ideation. I cannot do anything. Very confident feel to someone yang very worthless. So very extreme. Right. Next. Next slide. Okay, so bipolar, we have again we have subtypes of bipolar. We have bipolar 1 disorder, we have bipolar 2 disorder, and we also have cyclotymic bipolar. Alright, so usually in bipolar 1, alright, the usually we say that uh, the depression and manic can happen at one time, but in and also the manic is very, it's manic. Okay, that is the difference of manic and hypomanic. Manic is very extreme. Okay, but hypomanic in bipolar 2, this patient is going to be hypomanic, much lesser than manic. Alright, but still not normal lah. Alright. Okay, and usually it doesn't, the hypomanic and depression doesn't occur at the same time. Okay, while cyclothymic, alright, cyclothymic bipolar, the changes is very fast. Alright. Okay, and so and it can, in order for us to diagnose cyclothymic, we must really uh, follow up this patient maybe for 2 to 3 years. Okay, then we can say this person is cyclothymic. Right, but the changes is very fast. You can see the graph kan kat situ, very fast. Alright, maybe a few days je, 1 day or 2 days of hypomania is a depression, very interchangeable. Okay, right, next slide. Okay, now we go to the last or the fourth mental health, mental disorders, okay, which is schizophrenia. Alright, this is something that schizophrenia is, or the one mental illness that really affect our functioning. So, because the other three, okay, actually, if we really treat well, okay, the person's punya functioning, the orang kata how to say, the percentage of that patient gonna reach dia punya uh, apa old self back is higher than schizophrenia. Right? For schizophrenia, if we did not interfere or intervene earlier, right, this person probably lose their functioning forever. Okay, that is why we always try to educate public. Right? If anyone of your family members have symptoms of schizophrenia, better bring to us fast, because the earlier that we treat, okay, we may regain the functioning better. Alright. Okay. So schizophrenia is a mental disorder which is quite bad or quite severe. Okay. This person is going to have disturbance in their thoughts. Again, their thoughts. Alright. Even their speech. Alright. Their perception. Okay. And their own self. It's as if this person is going to lose themselves when they have schizophrenia. So schizophrenia usually will have psychotic symptoms. Alright. And this usually a patient with schizophrenia is going to lose touch with reality. They don't know what is real, what is not. Alright. That is usually, alright. This is tadi when I mentioned that depression and anxiety usually occurs in women, right? But schizophrenia is more in men rather than women. And schizophrenia also like bipolar, right? Much associated with family history. So this small pictures here said that right, schizophrenia boleh diwarisi dalam keluarga. Okay, you can get it from hereditary. Alright, so if you know anyone of your family members having schizophrenia, okay, because 10% of those yang ada family members with schizophrenia may have the same illness also. Alright, next slide. Yeah, so what is schizophrenia? Okay, usually this patient is going to have psychotic symptoms. So what are psychotic symptoms? Okay, psychotic symptoms consume of delusion, okay, ataupun delusi, whereby they have a false belief of something that is not really true. For example, the delusion is uh, we have a lot of subtypes of delusion. One of it is what we call grandiosity. Okay, grandiosity delusion is whereby the patient rasa that he or she is someone that is a king, for example. Okay, so this patient is going to tell that I'm a king in this country. Okay, which is not true. We all know who the king is in our country. So this patient is having the delusion. Okay, a false belief. All right, and that's false belief you can't counteract. Alright, even you say, for example, this patient is telling that, doktor, saya ni sultan dekat negara Malaysia. I'm a king here. Alright, so when you told this patient that, but the sultan is our agung and our agung is sekian. So this patient is going to give a lot of excuse that that is not the king, I'm the real king. So they're going to give stories like, well, agung tu sailang saya punya position, or actually sebenarnya saya yang kena jadi agung tapi tiba-tiba dia dapat pula. So you see, so if you tell them anything also, they will still have a fixed belief that they have gonna have that fixed false belief, right? Next psychotic symptoms is hallucination ataupun halusinasi. It can be in form of auditory, okay, hearing people's voices, visual, alright. Visual means you see things that is not there, alright, and also tactile. Tactile meaning, for example, you feel like ada semut dekat tangan. Okay, you feel like there's ants on your skin, but actually it's not there. So that is tactile in forms of touch. Alright. Okay. Also, the third psychotic symptoms in schizophrenia is the thoughts and the speech is very disturbed. So you're going to see is that you're going to talk to yourself and talk about we say it as irrelevant talks, alright, or merapu, okay, that you can't understand what this person is saying, alright. Next one is perilakuan yang bercelaru or changes in behavior or abnormal behavior. This includes catatonic lah. Alright. Okay, and abnormal behavior, it can be anything from suddenly dancing, suddenly crawling on the floor. Alright. Okay, very abnormal behavior. Okay. Then we have negative symptoms. Alright, negative symptoms in the sense of, alright, this person have no motivation, alright, like very empty, like a robot, don't don't do anything, alright, that is what we call negative symptoms. No emotion, right? So and this person is going to have difficulties in taking of themselves, alright, probably not taking bath, not eating until someone really force them to do so, alright. Going to have issues in their relationship, okay, as their and also in their functioning. So they can't do their job if this person is a mother, cannot take care of their children, alright. So this is schizophrenia. What this patient with schizophrenia are going to have lah. Alright, the next slide. Okay, so what are the signs and symptoms of schizophrenia? Alright, we have I already mentioned tadi lah. Okay, next. Okay, I covered that already. Next slide. Okay, so that are just the 4 common mental illness that I mentioned lah. We have other mental illness that again, mental illness, the key to diagnosing mental illness is it must causing distress, so much distress to the patient that this person is not functioning. Alright, like the usual, right? Like their old self. So whenever you feel like someone is having changes and extreme changes in themselves or are not functioning anymore, for example, not going to work anymore for maybe 1 month or 2 months, okay, not going to uh, can't study or not going to class, okay. So probably this person need help, right? Because again, probably this patient having some sort of mental illness. Alright, so now we go to the role of family and society. Alright, next. Okay, so it's a very common question whenever, because okay, we always advise all our patients to come with a relative. Okay, because one, history, we can't just take history from patient je, we must also take history from family members, because whenever those with mental illness, sometimes they don't realize the changes that they have, but those around them know uh, that this person is acting differently. So usually we will invite the family members to come also, so that we can get their input. on the patient himself, alright? And second, also, we want to educate the family members how they can help, alright? And family members also always ask, what can I do? Apa yang saya boleh buat? Because saya tak tahu apa nak buat lagi doktor, alright? Saya tak pernah, dia tak pernah macam ni. And these are usually lagi besar impactnya whenever the patient is someone yang the main or ketua keluarga, okay? The head of the family. So this patient, for example, a husband, a father, alright, is the one who is the breadwinner of the family, suddenly get mental illness. So, of course, not only the patient in distress, the whole family is also in distress. Okay, so that's why we would like to get the whole family members to be involved so that all of us can help the patient to improve themselves or to get better. Right? So first one is whenever we want to help someone with mental illness, either it's our friend or family members, first thing we must know what is mental illness, right? If we don't know, okay, how can we actually help them or even understand them, right? We don't even know what we are dealing with, right? So first of all, get to know of the mental illness that this someone is having. For example, if this someone is having schizophrenia, all right, you get to know in depth, all right, what is schizophrenia is, right? Second is get support, all right, get help, all right, okay. You can't manage this patient alone, all right. For example, if I said a husband or father is the one who is having this mental illness, right, you can't just rely on the wife to manage the patient, all right. If possible, if the siblings can also help in whatever way, all right, maybe in terms of financial, maybe in terms of support, just come and visit and see how they are doing, all right. So don't leave this family alone, all right, okay. Get the whole community, right, like the neighbor, all right, okay, to help this family who the father or the husband is having a mental illness, all right. Okay. Third is melibatkan diri semasa rawatan. Come for the appointment, all right. If you really want to help this person, come for the appointment. Ask the doctors, doctor, um, hari tu kan saya nampak dia buat macam-macam ni lah. Sebenarnya kalau dia buat macam tu, apa yang saya perlu buat Alright. Get to know the medication as well. Alright. Doktor, apa sebenarnya ubat yang doktor bagi? Okay. Kalau termiss satu hari, apa jadi? So, you get involved and also this patient also going to feel like you're actually really want to help them lah. Okay. Alright. And so again, berikan sokongan dan fahamilah, alright, okay. Those with mental illness, dealing with those with mental disorder is very challenging, alright. I do agree, I do admit that you really need to be very patient, kena sabar sangat bila kita deal dengan pesakit mental ni. Sometimes kita rasa macam dia mengada-ngada, like they are faking it, macam betul ke dia ni sakit, or is it just tak mengada-ngada, nak attention je ke, alright. So when we already have that kind of perception, alright, patient pun macam malas nak minta tolong lah, alright, okay. Nanti if I ask help from you, you will say that I'm weak or I'm just wanting attention. So what for I ask help from you? So try to don't have that kind of perception, right? Try to really understand, okay? Because of course we can never understand 100% because we are not in their shoes, alright? But if we just sit and ask, okay, that itself give patient like at least someone care, at least someone is concerned about me, alright? And that makes a very big difference towards the patient. Okay, next slide. Okay, so again, alright, we know that those with mental illness are very sensitive, okay, especially those with depression and anxiety. In schizophrenia, also in bipolar, if they are in manic or hypomanic state, their mind are not really stable. So their emotion also, they are not, how to say, they are not connected. Their thoughts and their emotions are not connected. But those with depression, anxiety, their mind is still sharp, alright, and it feels very sensitive. So anything sometimes, if we tersalah cakap pun, they will feel very down. So again, you have to be a bit very careful of how you talk. Okay, the words that you give to this patient, alright, you have to aware of what you are saying to them, so that whatever you're saying, although you're very well intentioned, it's not giving a different perception to them. Alright, so diorang tak baca salah. Okay, kadang-kadang niat kita baik tapi cara kita cakap tu yang buat dia lagi down. Alright, so example, how are we going to start, how we going to approach with those with mental illness? Okay, maybe kita tanya macam, right, for example ni, orang ni cakap, saya bimbang tentang anda. I'm worried for you, okay? I'm very worried of you. Alright, can we talk about what are your, what have you been experiencing? Alright, is there anyone that maybe you're not comfortable talking to me, but is there anyone that you want to talk with? Alright, maybe I can help to guide you to talk with someone. Alright, okay, so, and if this person tak nak bagi tahu you, okay, don't want to tell you anything, don't force. Okay, give them time, right? But always let them know that you are always available for them. Alright, okay, maybe they're not ready yet, or maybe they are not that trusting yet. Okay, but knowing that there's someone that they can fall back to, alright, is already actually very helpful for them. Okay, so maybe this is how you want to get them to talk to you. Because another example is, adakah sesiapa yang membantu anda menangani masalah yang sama pada masa lalu? Alright, is there anyone that I know that maybe can help you before this? If you experienced this before, alright, apa yang boleh saya lakukan untuk membantu anda membicarakan isu-isu ini? Maybe dengan parents ke ataupun dengan orang lain? Okay, yang probably boleh bantu anda. Okay. Okay, you want saya ada baca juga pasal apa yang experience, okay, maybe you can talk about that, okay. So actually the first action of getting help is by asking for help, okay. That's the first step towards you punya treatment. So kalau seseorang tu minta tolong, that's a good sign that dia nak sihat. So cara kita nak bantu pun mesti betul lah supaya orang ni tak lari. Elok-elok orang ni nak minta tolong, tiba-tiba cara kita salah, dah dia tak nak tolong, dia dah tak nak bantu sesiapa dah. Okay, right, next. Okay, so mengambil, alright, now, how kalau kita sendiri, alright, maybe kita tak ada mental illness, alright, maybe kita punya mental health is just a bit terganggu or disturbed, okay. I think all of us at one point of time has been experienced that, alright, that our mental health is a bit tired or exhausted. So even if we don't have mental illness, so what are the ways, the proactive ways that we can do to help ourselves, alright, for those yang ada mental illness disorder ataupun those yang ada whereby dia punya mental health is a bit disturbed. Alright, next slide. Okay, so the first key is, of course, there are time yang kita boleh bantu diri kita, okay. Time yang kita boleh bantu diri kita or just need help from our loved ones or just our friends. But sometimes, okay, having the support from our loved and friends is still not enough, okay. Even if we try our best to help ourselves, sometimes we need others punya help. And when I say others punya help, it's the professional help. So if you feel like you having, alright, some sort of the symptoms that I mentioned before, okay, or that it has been affecting your functioning, alright, and the duration has been more than 2 weeks, okay, or even if it's not 2 weeks yet, but you really feel distressed over that issue or have over that symptoms, you can actually just come to klinik kesihatan to have a check, alright. Usually, okay, kita akan bagi tahu pesakit akan selalunya the first tempat yang dia akan jumpa doktor usually klinik kesihatan. So pergi kat klinik kesihatan, alright, tell them what are you doing, what have you been feeling, what are the symptoms that you're having, how it affects you punya daily routine. Usually dekat klinik kesihatan, we have DAS scoring. Okay, if you ever heard of it, DAS scoring, alright, whereby dia akan minta you untuk isikan the borang to fill out the forms and answer the questions. Then from that form, from that DAS scoring, they can see your stress level, your anxiety level, your depression level, alright. And if they feel that it's a bit very significant, alright, or a bit teruk, okay, they will refer you to psychiatry, alright. So then The psychiatrists are the one yang akan um, evaluate your symptoms back, alright, and give a diagnosis. If needed, they will give also medications, alright. And also, psychologists are the one yang akan refer, if they think that you need counselling, they will refer to counselling. If they think you need therapy, they will refer you to clinical psychologist, alright. So, the first step is to go to klinik kesihatan. Any klinik kesihatan can do, alright. But if you feel like I'm not prepared to talk to someone face to face yet, we have hotline like befrienders, okay? Alright, you can call befrienders, okay? It's 24 hours, okay? Just to talk about issues, because sometimes when we just ventilate, we feel better, alright? So in middle of the night, you have that sense of losing control, dah terfikir nak having a suicidal ideation ke, or wanting to self harm or anything, just call befrienders, okay? You they don't they you are anonymous, they don't know who you are, they don't know where you live, alright. They just want to listen to your issues, okay. So get help however you need, alright. Okay, next slide. Okay, so in depression, for example, okay, that is first get help lah. Okay, let's say someone tu ada in psychiatry in general, okay, it's not just always medication, alright, it's not always just pharmacological treatment. That is one of the reason why orang tak nak, ataupun why orang takut untuk jumpa psychiatry. Kata nanti kalau jumpa psychiatry kena makan ubat, alright. Not every time come to us, even if we diagnose you with depression, not every time we will say you have to eat medication. Sometimes, if your symptoms is not that severe, all right, still mild, or we think that we have other methods to help you or to improve your symptoms, we don't start you on medication. All right, so don't be afraid because we have other type of treatments in psychiatry, which is non-pharmacological, depending on your situation. So we have a lot of therapy, and usually therapy are being done by the psychologist. Okay, so for example, in depression punya, in general lah, okay, not only depression, can be in bipolar and anxiety as well, alright. Also in schizophrenia, right, we have something that we call terapi tingkah laku cognitive or cognitive behavioral therapy. All this being done by the psychologist. So in cognitive behavioral therapy, psychologists usually sit with you, alright. They have their modules lah, alright. So it's not like one session, okay, few sessions usually, alright, very structured, okay, to mengesan cara kita berfikir, okay, to detect how we think and our behavior, alright. They sit with us and see, okay, why you think like that, why you behave like that, alright, okay, and what ways that can change that, okay. So it usually helps in our cara kita berfikir and our tingkah laku, our behavior. The next one, you also have therapy interpersonal, alright, or interpersonal therapy, whereby it's also structured that focus on issues in usually relationship that we have, and how, in what ways that we can help to improve our relationship with others. Okay, so usually maybe for example the depression is caused because of our issues with mother, mungkin parents, okay, or with our spouses. So in what way we can improve ourselves so the relationship can be improved, alright. For example, communication skill, alright. Then we have behavioral therapy, which is different than CBT, right? Because behavioral therapy or therapy tilangku is more focused on the activities that we can do, alright? What are the activities, the right activities that we can do to help improve our mood, okay? And our mental health in general. And then we have psychotherapy, psychodynamic, alright, or psychodynamic psychotherapy, alright. This is usually those who have issues since since childhood, those who has issues since past. Maksudnya masalah dia hari ni bersangkut paut dengan cerita yang dah lama, alright. So psychotherapy, psychodynamic ni, the clinical psychologist is gonna sit with you, and we're gonna pass satu those things that happened before, okay, and how we can change our perception on things that already happened and move forward, alright, to focus on our future, alright. Then of course we have the medical punya or the pharmacological part lah of treating depression. Okay, next. Okay. So since depression, okay, is one of the most common mental illness, alright. Orang akan tanyalah, so you come with this, okay, apa yang selalu kita akan buat, alright. First of all, if you feel like the cognitive behavior therapy is going to help you, okay, because usually in depression they will have negative thoughts, okay, to change that negative thoughts, okay, we might just refer you to the psychologist for CBT, alright. Then of course when you have depressive symptoms, okay, we will start you on antidepressant, okay, and usually, alright, this is not, I always tell my patient, this is not a magic drug, this is not a happy pill, bukan you makan you terus rasa okay, it takes weeks, okay, up to 2 to 4 weeks just for the medication to start to work. So you need to take every day, and for you to feel for you to feel the effect. And then usually it is 10 to 12 weeks continuously taking the medication to at least you rasa more stable. Right? So it takes time, okay. But it's okay, alright, because at least you know there's a solution rather than not doing anything about it. Okay, so it's something that you have to, orang kata istiqamah lah, something that you have to take it every day, alright. Then maybe, alright, we don't just start you on one antidepressant, okay, we might add on other medication to augment or to improve the effects of the medication on you, so that you feel more better lah, you feel more improvement, alright, in terms of your depressive symptoms. Okay, next slide. So anxiety is also the same thing, alright. You can do the therapy that I mentioned before. Can refer you to again there's clinical psychologists, okay, for the therapy to change the way you think. Again, because this person is always thinking about the same thing, alright. So maybe by doing therapy, alright, that can make a big changes on that. Right. And also we have anti-anxiety, and usually anti-anxiety and antidepressant is the same medication, okay? As of SSRI, it covers both, all right? And which is, it's good also because sometimes, like I mentioned before, when you have depression, you may have anxiety, and when you have anxiety, you may have depression, so it covers both, right? Next slide. Right. Bipolar also, okay, we can treat it with therapy, but the most important part is more of bipolar and schizophrenia lah. These two mental illness, we emphasize more on the medication, alright? Because if you stop the medication, okay, or you don't complete your treatment, the symptoms definitely going to come back. And when it comes back, usually it will be much worse than the previous the previous symptoms. So that is why we always emphasize on compliancy of medication. Okay, we always tell bipolar and schizophrenia to take your medication every day. And since they their thoughts are disturbed, that they don't know what's real or not, this is where the family members have to play their role lah. Alright, have to make sure that the patients are taking the medication according to the right dose. Alright, the therapy might help if the patient already stabilized. Okay, but if patient in acute phase, for example, is in psychotic, alright, is aggressive, how come we going to make the therapy with this patient? So we have to calm down them a bit. So medication will help that, right? We'll stabilize them first, right? If we feel that they are good candidate for therapy, then only we can refer them after they are stabilized, right? Next slide. Okay, same thing lah. This is schizophrenia. Next slide. Next slide. Okay, so there's a myth, okay, this is one of the mythos, okay, sebaik saja anda berasa lebih baik, anda boleh berhenti mengambil ubatan psikiatrik anda. Okay, so this is not the case, alright. This is not something macam headache, okay, you rasa sakit kepala, ambil Panadol, you feel better, then you need to take Panadol balik. This is different, okay. Psychiatric illness, alright, psychiatric disorder, you have to take the medication continuously. At times, okay, you may take it your whole life. Depends on your symptoms or what kind of mental disorder you have. Alright? So this is the issue. This is the issue of complacency that we have lah, because bila pesakit dah elok, dia kata saya dah elok, kenapa saya kena makan ubat balik? So kenapa saya kena makan ubat lagi? Whereby if they stop makan ubat, the chances of them to get untuk datang balik penyakit tu akan ada. Alright? Sebab in the end, they need the medication to stabilize dia punya mood and also their thoughts. Alright? Next slide. Okay, so in general, this is something yang kita semua boleh buat. Alright? Okay, to take care of our mental health. So when we take care of our mental health, that will definitely help us to avoid getting mental disorder. Even if we already have mental disorder, doing these tips, alright, will help will help in improvement of your mental disorder. First thing is appreciate yourself, alright? You must have that self-love, alright? Take care of yourself. A lot of those with mental disorder or mental health issues, alright, they tend to take care of others, alright, sibuk jaga orang lain, but diri sendiri tak terjaga. Which actually it all starts from you. If you don't take care of yourself, how are you going to take care of others? Alright? So, and this is why if we appreciate ourselves, we also don't do self-harm. In those who do self-harm, alright? Because if you know your worth, alright, you won't do things to yourself, alright? And kalau kita dalam bagi orang yang beragama Islam lah kita punya badan ni ataupun kita punya jasad ni is actually pinjaman daripada Tuhan. So kalau orang bagi pinjam barang like a pen, would you or a buku, adakah kita akan koyak-koyakkannya atau kita akan jaga dengan baik? Alright, so this is hanya pinjaman je, okay? We really have to take care of our health. And when I say health, not just physical, but also your mental health. Right? So appreciate yourself. Okay, have that self-love. Right? Second, take care of your physical health because it's interrelated. Alright, when you take care of your physical health, it will give you a very good mental health juga. So exercise well, that will also help in increase your mood, lift your mood. Alright, wujudkan sokongan keluarga dan sosial yang kukuh. Alright, this I think most of us is going to agree with me that no one can live alone in this world. Alright, everyone needs someone. Alright, so support is very important when things goes bad. Alright, sometimes we can't support ourselves. That is when our loved ones will tell us that it's okay, alright, you can do it, okay, they're the ones who are going to motivate us. So make sure you have very good support, and in order for you to have good people who are able to support you, you have to support others also. So it works both ways, right? Jadilah sukarelawan. Alright. So jenis sukarelawan is volunteer lah. Alright. Volunteer meaning help others. Alright. When you help others, okay, you will feel that you are useful. Alright. There's something that you can do. You are significant in this world. Alright. So when we able to help others, alright, that itself will help to lift our mood and build our confidence. Alright. Big one is belajar menangani stress. Okay, this one is very important lah. Alright, because sometimes nowadays lah, kadang-kadang stress sikit pun tak boleh. Alright, so you must know how to cope stress. Stress is inevitable. Alright, tak ada benda yang tak ada stress. Okay, you nak kahwin pun stress. Padahal benda tu is sesuatu yang menggembirakan. Betul tak? Tapi kalau you pandai tangani, alright, you know how to deal with it, and you have to be mature, see things in a mature way, alright? So when you're able to deal with stress, okay, although benda tu stress, you're able to overcome it, alright? Then tenangkan fikiran anda, okay? Alright, this is where therapy helps lah usually, alright? One of the things that can buat relaxation, okay, is deep breathing. Usually people with anxiety, you will teach them deep breathing exercise. But not only deep breathing exercise, you can do meditation, or you can do drawing. Benda-benda macam tu pun for certain people is very peaceful, alright? Okay, ataupun menenangkan minda, right? Dan tetapkan matlamat yang realistik. Don't put what to say, very high expectation on yourself, unrealistic expectation. Okay, sometimes it's okay to have less. All right, you can sometimes be able to live with less. But I'm not telling that don't be ambitious. Okay, definitely we have to always improve ourselves. Yes, but sometimes okay, it's okay that everyone have their own limit. All right, and if you can be up to that part, it's okay. All right, doesn't mean that you can't be happy. Okay, so don't put unrealistic expectation on yourself or even others. Okay, tukar rutin membosankan. If you feel, sometimes when you change our routine, okay, that will help to lift our mood juga. So usually kita tak pernah exercise. Now we exercise, we make it a practice. That every petang kita pergi jalan dekat taman, right? That way, when we have positive changes in our life, even a small changes pun, we will live our mood better. Right? Dan elakkan alkohol dan dadah. Alright, this is very important because alkohol dan dadah memberi banyak impact kepada diri kita dan bukan hanya diri kita, to others as well. Once you get involved with the addiction of alcohol and drug, it's really hard to get out. You can, but you really need big help and you sendiri kena sangat kuat untuk betul. So better prevent it before lagi teruk lah, right? Dan sentiasa dapatkan bantuan. Okay, so if you feel that don't take it as asking for help is weakness. No, alright, that is not weakness. In fact, if you able to ask for help, that just shows that you are strong because you know that you need others, alright, and you akui kelemahan diri sendiri. Okay, and it's okay, alright, to ask for help because hari ni hari kita meminta bantuan, hari lain orang lain pula yang minta bantuan, and at that time we will definitely help others. Okay, alright. So next slide. Okay, jadi macam saya cakap tadi, alright, as I mentioned before, okay, based on the talks that I have given, if you feel that you have, how are we going to know for sure that kita ada at least sedikit gejala or symptoms of mental illness? Okay, we can do DAS score, or we have other kaji selidik, alright, or questionnaire. For example, we have borang penilaian sendiri standard of PHQ-9. Okay, all this available online, alright, or GAD. This one is for depression. The others, yang GAD-7 tu is for anxiety. So you can do it online, right? Or you can straight away go to any clinic kesihatan. Actually, you can also go to GP and help them. If you really feel like I need a psychiatric assessment, okay, the best is go to clinic kesihatan lah. Alright, you can tell the doctors in KK what's your issues. Alright, after they did an assessment and a questionnaire, they can refer you to any psychiatric, government psychiatric. Alright, or if you prefer to go to general practitioner pun okay, GP, alright. Or if you feel like you want to go to private psychiatrist pun okay. Or you feel that probably it's not that bad yet, you can always go to counselor. If dekat university, you can go to counselor university, or the hospital pun we have our own counselor. But then again, you need referral letter from KK lah. So KK is the start. Anything, KK is the start. So afterwards, the next step is usually kalau psychiatry thinks that you need other kind of to clinical psychologist ke, for example, or to occupational therapy, for example, alright, we will refer you afterwards, okay? But asking for help is the first step, alright? Just pergi dulu, alright? If you feel tak nak pergi seorang diri, take a friend with you, alright? If you tak selesa nak orang lain tahu, then you can always go alone. In psychiatry, we always have this policy of PNC lah, private and confidentiality. So there's no, jangan rasa macam that benda ni orang akan tahu ke. Or satu lagi yang orang takut ialah kalau aku cerita pasal masalah aku yang involve for example family, ia akan mengaibkan family ke. Don't take that as macam tu lah, because it already affects you. Before things started to get worse, okay, go and get help as soon as possible, right? Okay, next slide.
I think that's about it. Thank you, everybody. Thank you, Doctor, for answering all the questions. And thank you, everybody, for your active participation. And our gratitude to our invited speaker, Dr. Hur Azmi, for kindly attending to all the questions. It will be a pleasure to have you for the closing ceremony tomorrow, Doctor. Will you be coming?
Alright. Yes, inshallah. 3 p.m., right?
Yes, it's 3 p.m.
Okay, all right. Sure.
Okay. So, on behalf of this organizing committee, I hope that all the information can help us relate to the importance of mental health and take care of ourselves better. Before we end this session, I would like everyone to switch on your camera for a photography session.